This lecture discusses the four diagnostic tools for diabetes. This is lecture number 3 of the diabetes series lecture. By the end of this lecture, you should be able to discuss the different tests that are used to diagnose diabetes and or screen prediabetes. There are 4 tests that screen for prediabetes and diagnose diabetes, and these are A1C, which is also used to monitor diabetes, fasting blood glucose, otherwise known as fasting plasma glucose or fasting blood sugar, the oral glucose tolerance test, which is the test used in diagnosis or screening gestational diabetes, and the random blood glucose, which is confirmatory of diabetes only if accompanied with classic symptoms. In the absence of unequivocal signs of diabetes, A1C, fasting blood glucose, and oral glucose tolerance test should be repeated for confirmation of diagnosis of diabetes. Please study and note Table 44.1, including the values. A1C, or glycosylated hemoglobin. The A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C level below 5.7% is normal. Between 5.7 and 6.4 indicates prediabetes, and 6.5% or above indicates diabetes. The A1C test measures the average blood glucose concentration over time, measuring the amount of glucose that binds to the red blood cells. Reflecting the average lifespan of a red blood cell, the test gives an accurate indication of long-term, time-averaged blood glucose levels over the 6 to 8 weeks prior to the A1C blood draw. When blood glucose concentrations are high, more hemoglobin is affected. Because it measures the average A1C level, it is a good tool to monitor the effectiveness of insulin therapy as well as the patient's compliance with diabetes management plan. On the day the HGB or hemoglobin A1C is drawn, neither eating nor fasting will affect the results, and the test can be done any time of the day. So remember, A1C does not require that the patient should have fasted the night before. A1C levels do not show fluctuations, and so episodes of hypoglycemia and hyperglycemia can be masked in the average. Measurement depends on the red cell survival and the composition of the red cell hemoglobin. So A1C results are inaccurate in several clinical situations, such as recent blood loss or transfusions. In addition, it is not accurate in a patient with anemia or a patient who received treatment with erythropoietin, both of which are common in patients with diabetic renal disease. How often should A1C be monitored? A1C results should be obtained at least twice a year for patients with diabetes and every 3 months if glycemic targets have not been met or if there are treatment changes. Fasting blood glucose. Fasting blood sugar test measures your blood sugar after an overnight fast. This would require the patient to be NPO after midnight. A fasting blood sugar level of 99 milligrams deciliters or lower is normal. 100 to 125 milligrams per deciliter indicates prediabetes, and 126 milligrams per deciliter or higher indicates diabetes. Fasting is defined as no caloric intake for at least 8 hours. So the instructions would be NPO after midnight. NPO is nil per oram, which means nothing by mouth. Oral glucose tolerance test or 2-hour postprandial glucose test. The oral glucose tolerance test is the test used for screening for gestational diabetes. Oral glucose tolerance test is done when the mother is between 24 to 28 weeks pregnant. This test is performed by asking the patient to consume a beverage containing a glucose load the equivalent of 75 grams of carbohydrate after fasting for 8 to 12 hours. Blood samples are taken prior to consuming the drink to get a fasting level, then again at 1 hour and 2 hours after glucose consumption. The diagnostic value is based on the blood glucose level 2 hours after glucose consumption. At 2 hours, a blood sugar level below 140 milligrams is considered normal. 140 to 199 milligrams per deciliter indicates prediabetes, and 200 milligrams deciliter or higher indicates diabetes. Random blood glucose or random plasma glucose. A random blood glucose level greater than or equal to 200 milligrams per deciliter in a patient with classic symptoms of hyperglycemia or hyperglycemic crisis is indicative of diabetes. This is the end of lecture 3. Thank you.